Hello, this is Dr. David Kahn, Associate Editor of JACI in Practice. Thank you for listening to the Highlights podcast for the April 2022 Volume 10, Issue 4 of our journal on the theme of health disparities in asthma and allergy. I would like to thank our theme coordinators, editorial board members Carla Davis and Julie Wang, who did a terrific job coordinating this first-of-its-kind theme, and for a well-crafted editorial that adds nice context to the review articles on the theme of health disparities. Regarding this theme of health disparities in asthma and allergy, first let me say that the editors were extremely pleased with the cover for this issue, which we feel is one of our best. But inside the cover, there are a whopping 11 separate reviews and feature articles on this topic. There are 3 CME articles that cover the topics of methods for cross-cultural communication, magnification of health disparities during the COVID-19 pandemic, social determinants of health and asthma. There are additional reviews that cover the topics of physician advocacy and achieving health equity, improving health disparities education for trainees and physicians, increasing representation of marginalized populations in allergy and immunology research, and the importance of sex and gender difference in asthma management. This theme also has a special article on a toolkit that was designed to develop structural competency in health disparities for allergy and immunology trainees. In addition, there are 2 separate rostrums. The first on diversity and disparities in the allergy immunology pipeline, and the second on race-based adjustments in pulmonary function tests. Lastly, there is an editorial on considerations for research and clinical care for Asian American patients. The content in this PAC theme issue should assist all of us in recognizing our implicit biases and understanding the steps we need to take to deliver equitable care for all patients, regardless of race, ethnicity, or gender. Let's now move on to review highlights from the original articles in the April issue, which cover the topics of health disparities, angioedema, asthma, drug allergy, food allergy, immunodeficiency, and rhinosinusitis. The first original article is entitled Geospatial Analysis of Social Determinants of Health Identifies Neighborhood Hotspots Associated with Pediatric Intensive Care Use for Life-Threatening Asthma by Grunwell et al. What is already known about this topic? Social determinants of health are associated with asthma prevalence and hospitalization in children, but are multifactorial and complex. Social determinants of pediatric intensive care unit, PICU, admission and readmission for asthma are not well described. What does this article add to our knowledge? Neighborhood hotspots with high social vulnerability and low childhood opportunity, identified through geospatial analyses, are associated with PICU admissions for critical and near-fatal asthma and longer hospital stays in school-age children. How does this study impact current management guidelines? Comprehensive assessment and mitigation of social determinants of health, in addition to biological factors, may improve health equity and the need for PICU admission in children with acute exacerbations of asthma. The next original article is entitled Social Vulnerability is Associated with Poor Outcomes in Preschool Children with Recurrent Wheezing Despite Standardized and Supervised Medical Care by Mutik et al. What is already known about this topic? Preschool children have a significant burden of wheezing. Although social determinants of health have been implicated in disparate asthma outcomes in school-age children, these determinants have not been studied in preschool children with recurrent wheezing. What does this article add to our knowledge? Preschool children at highest risk of social vulnerability have significantly poorer longitudinal respiratory outcomes, including more severe symptoms and more severe exacerbations, despite receipt of standardized and supervised respiratory care. How does this study impact current management guidelines? Comprehensive assessment of social determinants of health is warranted in even the youngest children with recurrent wheezing. Mitigation of these social inequities is an essential first step toward improving respiratory outcomes in pediatric patients. The next article is entitled Neighborhoods, Caregiver Stress, and Children's Asthma Symptoms by Rodriguez et al. What is already known about this topic? Neighborhood characteristics and caregivers' psychosocial functioning are each associated with children's asthma outcomes. What does this article add to our knowledge? Neighborhood safety was associated with children's asthma symptoms independent from caregiver stress and depressive symptoms. However, for children in unsafe neighborhoods, caregiver stress may partially explain the link between neighborhood safety and asthma symptoms. How does this study impact current management guidelines? Findings suggest that children with asthma may benefit most from interventions at multiple levels, including the family and the neighborhood systems. The next article is entitled Diet, Asthma, and Severe Asthma Exacerbations in a Prospective Study of Puerto Rican Youth by Reyes Engel et al. What is already known about this topic? Cross-sectional studies have reported associations among an unhealthy diet and asthma symptoms, and lung function in children and adolescents. What does this article add to our knowledge? In this study, an unhealthy diet at 2 study visits conducted over about 5 years was associated with asthma and severe asthma exacerbations in Puerto Rican youth, a high-risk population. How does this study impact current management guidelines? Our results suggest that physicians caring for children with asthma should promote a healthy diet in school-aged children and adolescents as part of their clinical management. The next article is entitled Angioedema Due to Acquired Deficiency of C1 Inhibitor, a cohort study in Spain and a comparison with other series by Beza et al. What is already known about this topic? Angioedema due to acquired deficiency of C1 inhibitor, C1-INH AAE, is a rare disease affecting mainly patients over 40 years old, frequently associated with hematologic and autoimmune diseases. 4 European series have been reported in the last 4 years. What does this article add to our knowledge? In this Spanish series, 8.7% of the patients were aged below 40 years at the onset of the disease. The face was the location of angioedema attacks present in 93.5% of patients and in 42.8% of them in every attack. Autoimmune thyroiditis was present in 21.7% of the patients. How does this study impact current management guidelines? This study emphasized the possibility of C1-INH AAE in patients younger than 40 and in autoimmune diseases other than systemic lupus erythematosus, such as autoimmune thyroiditis. There are some differences in presentation among series from different countries. The next article is entitled Inheritance Pattern of Hereditary Angioedema Indicates Mutation-Dependent Selective Effects During Early Embryonic Development by Bork et al. What is already known about this topic? Apart from indications by previously observed predominance of female carriers of F12 mutations in a small number of families with hereditary angioedema HAE with a specific mutation in the factor XII gene, there was no knowledge that HAE-linked mutations could impact on embryonic development. What does this article add to our knowledge? We found strong indications for a simultaneous selective advantage of female embryos and disadvantage of male embryos carrying the HAE mutation, with the likely additional loss of at least 20% of males in hereditary angioedema with normal C1-INH. How does this study impact current management guidelines? The presented data will be valuable for genetic counseling of patients with various types of HAE. The next article is entitled Treatment Decisions in Children with Asthma in a Real-Life Clinical Setting, the Swiss Pediatric Airway Cohort by Ardura Garcia et al. What is already known about this topic? Asthma guidelines recommend modifying asthma treatment according to symptom control and future risk for exacerbations or medication side effects. However, we know little about what drives pediatric pulmonologists to adjust treatment in children with asthma. What does this article add to our knowledge? In this tertiary care real-life study, lung function and asthma control had a key role in treatment step-up, and FeNO in stepping down, with marked heterogeneity between clinics. How does this study impact current management guidelines? Understanding how asthma guidelines are followed in routine care may help to improve both recommendations and clinical practice. The next article is entitled Artificial Intelligence Assesses Clinicians' Adherence to Asthma Guidelines Using Electronic Health Records by Sagheb et al. What is already known about this topic? Asthma guideline adherence in primary care is low, missing opportunities to improve asthma care and outcome. However, assessing clinicians' guideline adherence requires manual chart review of electronic health records not readily applicable in asthma care. What does this article add to our knowledge? Natural language processing enables an automated assessment of clinicians' adherence to asthma guidelines based on electronic health records and can be a useful population management and research tool to assess and monitor asthma care quality. How does this study impact current management guidelines? A natural language processing empowered assessment tool alleviates costly and challenging manual chart review of electronic health records and provides an innovative approach to assess and improve clinicians' adherence to evidence-based asthma management guidelines. The next article is entitled Reliability of Early and Late Testing for Suspected Perioperative Hypersensitivity by Vanderpoorten et al. What is already known about this topic? Diagnostic investigation for a perioperative hypersensitivity reaction is thought to be best performed at least 4 to 6 weeks after the event. Some guidelines discourage in vitro testing later than 3 years after the index reaction. What does this article add to our knowledge? This study showed a high proportion of positive skin and in vitro tests within 6 weeks after the reaction. For in vitro and ex vivo tests, sensitivity may decline over time. However, we still found positive tests more than 3 years after the index reaction. How does this study impact current management guidelines? The study challenges the doctrine that diagnostic workup of perioperative hypersensitivity reactions is best postponed until 6 weeks after the reaction, and that in vitro and ex vivo testing should be discouraged later than 3 years after the event. The next article is entitled Different Patterns of Foods Triggering FPIES in Germany by Lang et al. What is already known about this topic? Food protein-induced enterocolitis syndrome, FPIES, is a rare disease presenting with protracted vomiting after ingestion of triggering foods. Severe reactions may lead to shock. Milk, soy, rice, and fish are the most frequent elicitors worldwide. What does this article add to our knowledge? Besides cow's milk and fish, we identified beef, poultry, rice, and potatoes as most frequent FPIES triggers in Germany. Development of tolerance is shorter in chronic than in acute FPIES and differs between triggering foods. How does this study impact current management guidelines? Guidelines on the introduction of complementary foods in infants with FPIES should be based on data from regional studies, as different dietary habits in different countries may lead to different characteristics of FPIES. The next article is entitled Triggers for Home Epinephrine-Treated Reactions During Oral Immunotherapy for Food Allergy by Nakshin et al. What is already known about this topic? Severe home reactions to previously tolerated doses are a main safety limitation of oral immunotherapy, OIT. Previous descriptions of potential triggers for such reactions are limited by their small sample sizes. What does this article add to our knowledge? We identified triggers: physical exercise, fatigue, and concurrent infectious disease, and protocol-dependent dose size, dosing interval, and independent factors, seasonality, associated with home epinephrine-treated reactions in a large group of patients undergoing OIT for various foods. How does this study impact current management guidelines? The identification of triggers and various factors associated with home epinephrine-treated reactions during OIT may assist both caregivers and patients in minimizing the risk for such reactions and improving treatment safety. The next article is entitled Long-Term Clinical Outcomes of severe combined immunodeficiency patients given non-ablative marrow transplants by Hardin et al. What is already known about this topic? Available long-term outcome data about patients with severe combined immunodeficiency are limited. Survival has previously been reported to be superior in infants transplanted early, less than 3.5 months. What does this article add to our knowledge? We continue to note better survival long-term when transplanted early, less than 3.5 months. We found an overall higher prevalence of attention deficit hyperreactivity disorder, ADHD, warts, and learning disabilities compared with the general population. How does this study impact current management guidelines? Early transplantation remains of key importance for survival. As transplanted population ages, additional dermatologic and gynecologic monitoring may be warranted. Early assessment for learning disabilities and ADHD may be beneficial. The last article is entitled Olfactory Outcomes with Dupilumab in Chronic Rhinosinusitis with Nasal Polyps by Mulal et al. What is already known about this topic? Loss of smell is one of the most important and difficult to treat symptoms for patients with chronic rhinosinusitis with nasal polyps, CRS with NP. What does this article add to our knowledge? Dupilumab produced rapid, significant, and sustained improvement in sense of smell in patients with severe CRS with NP, including those with prior sinonasal surgery and those with comorbid asthma and nonsteroidal anti-inflammatory drug exacerbated respiratory disease. How does this study impact current management guidelines? The ability to alleviate loss of smell, one of the most troublesome and difficult to treat symptoms of severe CRS with NP, supports Dupilumab as an effective treatment for patients with CRS with NP who otherwise have limited therapeutic options. This concludes our highlights of the April 2022 issue of JACI in Practice. I'm David Kahn. Thank you for listening, and I am confident you will find this issue informative and helpful in the care of your patients in an equitable manner.